Hello. Today in our MK Cognition interview series, we'll be learning about Phil's fight against Alzheimer's disease. Dr. Mikhail Kogan, the founder and chief medical director of MK Cognition, will be in conversation with Dr. Nancy Steitz, Phil's daughter. Thank you both for being here today with us. Dr. Kogan, could you please start by telling us a bit about yourself?
Thank you, Nancy, for coming.
Thank you.
I've treated your father um, for a number of years. I met him about 10 years ago. Let's start by I'm going to ask you, tell us who Phil was and how his Alzheimer's progressed.
My father was a World War II veteran, passionate about social change and social justice, one of the original directors, associate directors of VISTA, Volunteers in Service to America, father of 5, grandfather to 6, who was diagnosed with Alzheimer's, mild cognitive decline, when he was 70 years old. He met you when he was 83 years old at GW Hospital, where he was hospitalized for pneumonia, and my mother was hospitalized for a brain tumor. And we realized that he needed more intense inpatient care, and so we moved both my parents to assisted living facility, and you became their doctor. And my mother died within a year, but my father, against all odds, lived for another 8 years until he was 90 years old. So we are extremely grateful to you and what you did for my father. And can you tell me a little bit about how you diagnosed my father and his progression?
Sure. Well, he was already diagnosed. My mentor, Dr. Cooper, diagnosed him in 2002, right?
Yes, 2002.
So he was already under care of memory expert at that point. And when I came to start treating him, his Alzheimer's was very progressed. He still recognized you, but he was quite disoriented. He wasn't oriented to time, place, and we put him. We suggested that he goes into even hospice care a couple of years into this.
Yes.
But we also optimized his nutrition. We added regular physical therapy and exercise. When he moved to Sunrise, he started having a lot of interesting activities that he always enjoyed. He played chess, and he spent a lot of time with staff, and I'm sure you'll tell us a little bit more about this maybe in a minute. And we also controlled his inflammation. So we found that early on he had a lot of factors showing high markers of inflammation, high cholesterol, high C-reactive protein. So we've optimized the diet. We've added some supplements to control his inflammation, and also we gave him some supplements to balance neurotransmitters to try to decrease his anxiety and also have him respond to stressors better.
Dr. Kogan, could you tell us a little bit about the basic principles of your protocol and how it might differ from how other clinicians treat their patients?
MK Cognition addresses cognitive impairment and memory disorders utilizing lifestyle optimization and metabolic program. We use nutrition change, exercise, stress reduction, targeted supplements, and even standard medications that are used for Alzheimer's disease. This work is largely based in Dale Bredesen research and his recent development of what's called a RECODE protocol that he elegantly describes in this wonderful book called The End of Alzheimer's. Dale also gives a long history of research on this topic, highly recommended book. In addition, we developed a program that instead of having patients come to the clinic, we have a team that includes nutritionist, health coach, geriatric case manager, home health aides, that go to the patient's home, wherever they are, whether they're in their own house or in assisted living, or even if they're in a nursing home. Even in an advanced stages, we think there is potential for some slowing down or even maybe arrest of the decline of cognitive impairment. And that's what I think makes us unique, is that we have a whole team approach. You are good. Your father was a good example of what effective team approach can achieve, in addition to putting all the right medical tools in. And I think that's part that's missing in a lot of programs out there, is that people tend to think that if they bring patients to their clinics, that's enough. And I feel strongly that's not. I think that it's a whole team at the patients.
An integrative approach.
Exactly.
Dr. Steitz and Dr. Kogan, thank you so much for joining us today and sharing Phil's story. And for those listening to us, please feel free to go to restorememory.org for more information.